Understanding Pain by Sid Nadler. What does pain mean to you? Is it physical? Is it psychological? Or perhaps is it both? You see, pain can be any combination of these. We mostly associate pain with a physical harm that causes a disturbance to one or many of our body systems and tissues. This disturbance is not enjoyable or pleasant for most. Because of this, we try to avoid painful situations and incidences. Everyone interprets pain in a different way, and this is all dependent on past experiences with pain. So let's try to understand this in order to recognize that pain actually plays a very important role in our lives, specifically for survival. There are two categories of pain. One is acute pain and the other is chronic or persistent pain. Acute pain is a response to actual tissue damage and is a protective response that is temporary and eventually will go away. Chronic pain, however, will continue for greater than 3 months even after the pain stimuli has disappeared and has no protective purpose. I'll talk about this later in the video, but first I want to explain how we actually interpret a stimulus as pain. Here's a little bit about how our bodies actually perceive pain. Let's imagine a cut to the skin. When our skin is cut, specific nerve endings located within the skin sense a disruption and are activated. These free nerve endings send a signal to the spinal cord by way of a specific nerve fiber called A delta and also one called C fiber. I want you to recognize that there are many other pain fibers, but for this situation we will talk about A delta and C fibers. These fibers form a synapse or connection with a second neuron within the spinal cord. The second neuron will then cross to the other side and ascend up to the thalamus. The thalamus is a specific area within your brain that receives many different signals and sorts through them so they are sent to the proper area within the cortex. The thalamus will receive this incoming message and send a new signal to primary somatosensory cortex that perceives the signal as pain. So as I said before, this signal crosses within the spinal cord. So that pain you feel on your right side is actually interpreted by the left side of your brain. Kind of cool. This overview is a summary of the path a pain signal travels in order to be interpreted by the brain. Every time you experience a painful incident, this is what occurs in the body. What is happening with persistent pain then? The painful stimuli may be absent, but the brain is still interpreting an incoming signal to be a painful one. I'd like to start by saying that persistent pain is often associated with comorbidities such as medication abuse, misuse, insomnia, and depression. Unfortunately, this is very common too. 1 in 6 Americans experience persistent pain according to the American Chronic Pain Association. To better understand persistent pain, I want you to imagine a traumatic event taking place, perhaps a bike accident. Your body will immediately respond by releasing stress hormones, a protective fight or flight response, or if you're unable to remove yourself from the painful situation, a freeze response will occur and you'll shut down by inducing a pain-free state. These hormones are actually causing the brain to over-encode the traumatic event into memory, which is why it is difficult to talk about this traumatic event again in the future without actually feeling like you're reliving the situation. So there's many different reasons for persistent pain, but one of them is called central sensitization. This occurs when within our central nervous system, so our brains and spinal cords, rather than on the periphery like in acute pain. Let's think back to the explanation of the pain pathway. As tissue damage occurs, the signal is perceived and then travels to the spinal cord where it crosses then ascends to the brain. When central sensitization occurs, the neurons in the brain that interrupt pain can become highly sensitized by having lower thresholds or expanded receptor fields. This means that a stimulus such as light touch that would normally not be strong enough to activate pain receptors will now activate those receptors because they are more sensitive and their threshold of perception has decreased. With a continued sensory input, these receptors will maintain this sensation and pain will continue in the absence of a painful stimuli. So this is a brief overview of persistent pain, but I hope that this video has helped increase your understanding of pain and that you can now acknowledge that it is a complicated process. It can be tackled with a holistic, team-based approach that treats the whole individual. So hang in there. Thank you.